Today is World Mental Health Day, and the goal is to raise awareness about the 1 in 8 people globally living with a mental health condition. Here at CBS 8, we are dedicated to helping people by providing information on important resources because you matter. Joining us now with more on what we can call and do to support those who might be struggling, especially young people, is Dr. Willough Jenkins, pediatric psychiatrist from Rady Children's Hospital. Dr. Jenkins, thank you so much for joining us here on the floor.
Thank you for having me.
What is World Mental Health Day for people who aren't familiar with the day?
Yeah, World Mental Health Day happens every year on October 10th, and the idea is to spread awareness on a global level about mental health issues. The theme this year is that mental health is a universal human right, and it couldn't be more timely.
One of the things that we've been noticing, that of course this has been going on for years, but really just in the last few days, the news that we are seeing on our social media feeds, that our children are being exposed to, because so many kids have phones these days. There are people that can't sleep at night. This is causing a tremendous amount of anxiety. Can you give us a little perspective on trying to explain what's happening in the world globally to our children?
Absolutely, and I think the first thing we need to do is reassure our children that they are safe, and let our children know that we are in control here of our emotions, and try to remain calm and manage your own anxiety around your children. And then when you're wanting to talk about difficult news topics, it's important to talk at an age-appropriate level, but be honest, and also make sure they're getting the information from you. So with that, being mindful of what type of news that they're watching. There's some very disturbing visuals that are going online right now, and it might be appropriate to ask your child to take a break from their social media, to be mindful that they may come across this type of content that could be very disturbing.
Yeah, I think that's excellent advice, because you can be scrolling, looking at one thing, and before you know it, there's something else right in front of you, and then you're triggered at that point.
Absolutely, and for every child it's so different. If your child's already someone who's anxious or a little bit sensitive, you might have to be even more strict.
What do you see coming into Rady Children's Hospital as far as our youth and mental health? Where are we as far as kids in this community, and where they are as far as their health is concerned?
Well, unfortunately, we are still in a youth mental health crisis, and our rates of mental health illness are still increasing. We have children coming in up to 30% more than we used to, with depression, anxiety, thoughts about suicide, concerns about their safety. So we are unfortunately very busy these days.
What do you advise parents to do or to look out for when it comes to their child or their teenager in mental health? Are there things that maybe we should be paying much closer attention to that we used to just brush off?
Well, I think first, knowing that the rates are so high, you have to ask your child how they're doing with their mental health, and having really open and honest conversations that are non-judgmental. Looking for signs like if they're having difficulty sleeping, they're more irritable than they normally are, which I know is tough with teens, changes in eating habits, and of course if they're moody or sad or talking about death or talking about suicide, these are all indicators that you need to get help quite urgently.
If you do need that urgent help, whether it be an adult or a child here in San Diego County, where can people go? What do they do? Who do they call?
Yes, well, if it's not urgent, of course, go to your pediatrician or your primary care provider, and they can be a great first place to start. If it is more urgent, we have a national suicide prevention line, 988. You can text HOME to 741-741 and get an immediate response. We have a wonderful San Diego access and crisis line you can call in and get local resources. But of course, a mental health emergency is as important as a medical emergency. Call 911 or go to your emergency room if you're in crisis.
There's a lot of resources out there, and thanks to folks like you, Dr. Jenkins, there's a lot of help out there too.
There is a lot of help and a lot of hope. There's very effective treatments for mental health.
All right, Dr. Willough Jenkins from Rady Children's Hospital, we appreciate your time so much and what you're doing to care for some of our kids here in this community. So again, if you or anybody that you know needs immediate help, you can call 988 to be connected to the Suicide and Crisis Lifeline. We're going to put up some information here. There's also the San Diego County Crisis Lifeline. The number's on the screen, 888-724-7240.